My name is Bobby Mahajan, and I'm an interventional pulmonologist at the Inova Schar Cancer Institute. In my role as an interventional pulmonologist, my job is to deal with complex airway diseases and pleural diseases. Interventional pulmonology is a kind of a super subspecialty of pulmonology. Typically, we deal with advanced cancers involving the airways, diagnosing cancers that are throughout the lungs, and dealing with cancers that are around the lungs in the pleural space. Usually what we'll end up doing is, based on the patients, if they come in with an undiagnosed abnormality of the lung, such as a lung nodule, what I end up doing is biopsying those nodules and also staging them, so looking at the lymph nodes to see if there's any cancer involved. I'm able to biopsy them, look at them under on-site cytology with our pathology department, and once we know exactly what the type of cancer is and the stage, essentially what I'll do is triage the patient, meaning that I'll be able to say, well, if you're early stage disease and you're a good candidate, we'd move them towards surgery with our thoracic surgeons. If it's more advanced disease, meaning past a 3A disease, usually they wouldn't benefit as well from surgery, so we actually will triage them to our oncologists and our radiation oncologists, mainly because we want to be able to provide them with the most effective but also the safest care. On top of that, the worst part is honestly waiting for that decision on where they're going to go next. So really my goal is, with our cytology department, our oncologists, our thoracic surgeons, is I serve as kind of the gatekeeper, that once we know what the diagnosis and stage is, I can expeditiously get them to the right place so they're not worrying about what the next step in their treatment is going to be. I have a pretty laid-back approach, but also understanding that they're coming in with a very stressful situation. So if I can be relaxed, confident in what I do, I think that makes them more comfortable. And frankly, I try and treat them as if they are a family member, because I'm going to be taking care of them and seeing part of them that no one's ever seen before. So if I can be relaxed, laid back, and I go by Bobby as opposed to Dr. Mahajan, I think they feel more comfortable. The most common question I get is everything going to be okay? And frankly, in all honesty, I don't know until I take a look. And I'm honest with them and saying, look, no matter what's going on, we're going to have a diagnosis and we're going to have a plan as to what we're going to do about what we find. Dealing with cancer, in the long run, it'll be okay. But frankly, I tell them I just don't know until we start doing some work, and that's what our job is, to get moving forward so you can get a plan and a treatment option. My name is Bobby Mahajan, and I'd be honored to be part of your care team.